Hello everyone, in this video I'll be explaining on the topic Vibrio cholerae, Campylobacter, Pseudomonas and Helicobacter. Here coming first to the Vibrio cholerae. The morphology of this Vibrio cholerae are they are gram-negative bacilli, short rod which are often curved or resembling a comma shape. The organism is actively motile with a polar flagella and movement is named as darting motility. The Vibrio cholerae are classified mainly into group A cholerae vibrios which are biochemical similarities common and age antigen, and group B are biochemically and antigenically heterogeneous. Under group A is being classified into classical and Altor, and then into non-01 currently up to more than 200. And then these classical and Altor are again classified into three serotypes: Ogawa, Inaba, and Hikojima. Coming to the mode of transmission, Vibrio cholerae is the causative agent responsible for causing cholera. And the bacteria are transmitted between humans through fecal-oral route, and they they get infected by ingestion of contaminated food and water contaminated with the bacteria. The method of prevention, it can be avoided by avoiding ingestion of contaminated food and water or raw foods and proper hand hygiene. Coming to the collection and transport of samples, the watery stool specimen should be collected preferably prior to start of antibiotics into a sterile container. Specimen should be immediately transported to the laboratory. In case of delay, stool samples may be preserved in holding media such as VR fluid media or Venkat Raman Krishna fluid medium or transport medium. Next is the Campylobacter. It is an important human pathogen in diarrheal diseases and accounts for 90% of Campylobacter infections. The morphology of this Campylobacter is they are small, curved, gram-negative bacilli which are motile by polar flagella, that is, having only one flagella at one end of the bacteria, and they are non-sporine and non-capsulated. Mode of transmission, it is the infection occurs by ingestion of raw milk, contaminated water, or partially cooked poultry. The method of prevention is wash your hands before cooking and after touching raw poultry or meat, and then keep undercooked meat and poultry away from other foods such as vegetables by using separate cutting board utensils and cooking surfaces. Wash your hands after touching a pet or pet feces. Coming to the collection and transport of samples, the stool sample collected in a sterile container and then transported to the lab in Clary-Blair transport medium if delay. Next is Helicobacter. Helicobacter, it causes chronic active gastritis, duodenitis, and peptic ulcer. The morphology of this Helicobacter bacteria is they are short, curved, gram-negative bacilli and motile bipolar flagella. Coming to the mode of transmission, likely through oral to oral or fecal-oral, commonly transmitted person to person by saliva. The bacteria can also be spread by fecal contamination of food and water. In In developing countries, a combination of untreated water, crowded conditions, and poor hygiene contribute to higher infection. Coming to the method of prevention, washing hands thoroughly, eating food that is properly prepared, and drinking water from a safe, clean source are important steps for preventing Helicobacter infection. Next to the collection and transport of sample, in these endoscopic biopsy of gastric mucosa are collected. Next, coming to the Pseudomonas. This Pseudomonas is a slender gram-negative bacilli and actively motile bipolar flagellum, and they are non-capsulated and non-sporing. The mode of transmission, it includes the transmission occurs from patient to patient on the hands of healthcare workers by patient contact with contaminated reservoirs and by the ingestion of contaminated materials. The method of prevention, Pseudomonas infection between patients, healthcare personnel, and must follow specific infection control precautions. These precautions may include strict adherence to hand hygiene and wearing gowns and gloves when they enter a room where patients infected with Pseudomonas are staying. Next, coming to the collection and transport of samples. The samples of urine, pus, wound swab, sputum, blood, and CSF are collected into a sterile container under aseptic condition.